In other news, a Lagos-based lawyer, Justice John, has asked the Lagos State government as well as the Medical and Dental Council of Nigeria to investigate the alleged avoidable death of his wife, Akudo, on the 4th of December following childbirth at a gynecological specialist hospital in Lekki. Mr. John said his wife, who had a smooth pregnancy, suffered excessive bleeding, which led to her death after giving birth to a baby weighing 4.2 kilograms.
Justice John alleged that after delivery on December 3, his wife continued to bleed and complained of discomfort. He says despite her condition, she wasn't given proper medical care nor referred to a higher level facility earlier.
The hospital brought a stretcher without guards or straps to evacuate my wife. While moving her, she fell off the stretcher onto the tiled walkway of the 3rd floor. I challenged the hospital to release the CCTV footage of the 3rd floor from that day to the public. I rushed to help lift her back up. The staff seemed confused about whether to use the stairs or elevator, thereby wasting valuable time during such an emergency. When the driver finally opened the door, he stated he needed to connect the battery. Throughout the chaos, my wife lay in the open on a stretcher, unattended and without oxygen. The ambulance finally took off. I insisted the consultant accompany her as the most experienced personnel available. I drove behind the ambulance, which stopped twice on the way. I then led them to Lagos Island Maternity Hospital, where my wife was pronounced dead on arrival.
The member of the Nigeria Bar Association Lagos branch says that while Gynecological Specialist Hospital issued a death certificate indicating cardiac arrest as the cause of death, an autopsy later conducted at the Lagos University Teaching Hospital reportedly listed hemorrhagic shock as the cause.
Beyond being our colleague, even if this were any regular citizen, to lend our voice to causes that we believe will spotlight changes that should be made.
In its reaction, Gynescope describes the incident as a painful loss but denies claims of negligence. It says all reasonable and available medical interventions were deployed in a sustained effort to preserve Mrs. John's life, which included voluntary blood donation by members of its medical and management team who were compatible and present during her care. As the controversy rages, there's been no reaction yet from the state government or the Medical and Dental Council. Kemi Foladeyemo, TVC News, Lagos.